this was a team effort by lots and lots of people over many years. But I think a crucial element of this was Jim Mason, who was director of CDC in 1985 to 8 in that time period, and who was right away saw the merits of having more chronic disease activities and health promotion.
But if you were to say who was the driving force, it would likely be Jeff Copeland, no question. He was there from the beginning. He helped move the process along with the support of CDC directors.
We knew what we wanted the town to look like when we were done, so we wanted to be able to walk down the main street and see storefronts that said heart disease, cancer, diabetes, tobacco, reproductive health, etc. And much like that building of the Western set, many of our storefronts were little more than the facade of the storefront with kind of a 2x4 holding it up. And that was okay. Once we had staked out the town and what we wanted it to be, we felt we could then build behind it, but we had to build fast.
During those early years, it was, of course, really exciting. We were putting together the school health models, we were building the center, really pulling things together from across the CDC to build out this new Center of Chronic Disease Prevention.
It had its difficulties in several ways. First of all, CDC was known so much for its communicable disease work, so that there was a question, would this draw resources away from that more traditional work?
To add something new to the portfolio, to change the focus a bit, to expand the scope of what that entity is a bit of a challenge.
Probably the second issue is could public health practice really make a difference in the chronic diseases, which were really thought of as clinical conditions more or less. Up until that time, the only way a program in chronic disease was successful was whether the death rate dropped. But with the behavioral risk factor surveillance system, where they would do a survey of adults in each state and ask them whether they smoked, whether they exercised, and things like that, you started to see the steps before the disease.
Bringing VERB up was one of the most exciting projects that I've ever been party to. It was an entirely new effort for CDC to join with the country's best marketers and really design how can we encourage tweens to become active in the country by using the absolutely best marketing techniques. And it was wonderfully effective.
Amongst the highlights were the growth of many of the programs, the breast and cervical cancer program in particular, which started off with first nothing and then a $500,000 grant working in 1 or 2 states, and growing to a nationwide program with lots of resources and the opportunity to help lots of women be screened for cancer who wouldn't have been before.
Probably an area that I am very proud of because it was so different was arthritis. It was important to grow because we know that a large part of what happens to people with chronic illness is pain and suffering. This was the model for that. So it was about quality of life, reducing suffering, even if it wasn't something that killed people.
We got funding for REACH, which is the community effort that really is focused on eliminating disparities in communities, which I think is the heart of public health work. And then we received resources to do a program called STEPS, and it was a major investment in community health to address the underlying risk factors of chronic disease. So this has revitalized our efforts in community health, and I think we have now excellent models that can be built out across the country.
I think public health has changed in its sense of who are appropriate partners over the last 20, 30 years, and in so doing has enriched the field, and we're much more effective.
Partnerships for this work were essential from the beginning in several ways. One is we almost had to develop them. When we started, there was no organization of chronic disease directors in the States, and we gave them a seed grant to form one so that we had an organization to interact with.
Basically everything we do are through partners. public health partners at the local and state level, business partners, the nation's schools. We actually fund departments of education at the state and local level to work with schools around the country.
I had the best people working for me. I always felt they were working hard and doing their best to make a difference. And I was very fortunate to both get the credit for what they did, but actually have them I felt like my job was to work on their behalf so that they could get even more done.
The center's been blessed with very talented people and leaders in their fields in virtually every area that we've worked in. And that's from day one right through its course. And so I don't think we've missed a beat where one person has left, so that baton's been handed off to an equally fast competitor who's kept it moving around the tracks.
It's a very vibrant time for the center, and we have an enormous portfolio of work underway. We've been invested in our work on nutrition, physical activity, and tobacco use, and I think adding alcohol to that. Our work in the interrelationship of mental health and these chronic disease issues is going to be very important.
To even be away for some period of time, but to look over the wall and see what's going on and know that it's just getting better and better.